proteinuria. It's a word you might not hear often, but if you're experiencing it, your kidneys could be at risk. This condition happens when too much protein leaks into your urine, which can be a sign of significant kidney damage. Over time, if left untreated, proteinuria could lead to serious complications like chronic kidney disease and even kidney failure. But here's the good news: proteinuria can be managed, and there are several ways to reduce or stop it altogether fast. In this video, we'll explore 10 proven methods to stop proteinuria and protect your kidneys. These methods are backed by science, and with consistent effort, you can improve your kidney health and overall well-being. Let's dive into the first strategy. 1. Control your blood pressure. High blood pressure is one of the primary causes of proteinuria. When your blood pressure rises, the blood vessels in your kidneys suffer, which compromises their ability to filter waste and protein properly. Maintaining healthy blood pressure is essential in preventing and reducing proteinuria. Studies have shown that keeping blood pressure under control can reduce the leakage of protein in urine and slow the progression of kidney damage. So, how do you manage your blood pressure effectively? First, focus on lowering your sodium intake. The average person consumes far more sodium than they need, which can elevate blood pressure. Aim to keep your sodium intake below 2,300 mg a day, or better yet, under 1,500 mg if you already have high blood pressure. Make an effort to avoid processed foods, salty snacks, and fast food, as these are often packed with hidden sodium. Another key factor is physical activity. Engaging in regular exercise such as brisk walking, swimming, or cycling can help reduce blood pressure naturally. Aim for at least 150 minutes of moderate intensity exercise per week. Additionally, medications like ACE inhibitors or ARBs may be prescribed by your doctor, as they are particularly effective in protecting the kidneys and reducing proteinuria. 2. Optimize blood sugar levels. High blood sugar is another common culprit of proteinuria, especially in people with diabetes. When blood sugar levels remain elevated, they cause damage to the blood vessels in the kidneys, leading to the leakage of protein into the urine. That's why it's crucial to maintain healthy blood sugar levels if you're serious about stopping proteinuria. Managing your blood sugar starts with a healthy diet. Choose foods that are low on the glycemic index, like whole grains, leafy greens, nuts, and legumes, which release glucose more slowly into your bloodstream. This helps prevent spikes in blood sugar. Additionally, fiber-rich foods like oats, beans, and flax seeds can help stabilize blood sugar levels. Regular monitoring of your blood sugar is also key. If you have diabetes, using a glucose meter to keep track of your levels is essential. Aim to keep your blood sugar within the target range set by your healthcare provider. For some people, this might mean fasting blood sugar levels below 100 mg/dl and post-meal levels below 140 mg/dl. If lifestyle changes alone aren't enough to manage your blood sugar, medications like metformin, insulin, or SGLT2 inhibitors can help control glucose levels and protect your kidneys. Research has shown that tight control of blood sugar can reduce proteinuria by up to 50% in diabetics, a significant reduction that can save your kidneys from further damage. 3. Increase your water intake. Hydration plays a critical role in supporting kidney function. Your kidneys need plenty of water to filter out waste products and keep the blood flowing through the kidneys efficiently. When you're dehydrated, your urine becomes more concentrated, which can worsen proteinuria. The general recommendation is to drink about 8 glasses of water per day, though individual needs can vary depending on your size, activity level, and climate. For those with kidney issues, staying hydrated can help dilute the substances in the urine and prevent the further buildup of waste that stresses the kidneys. However, it's important to note that if you already have advanced kidney disease, your doctor may give you specific recommendations about fluid intake. Be sure to follow their guidance to avoid fluid overload. Drinking enough water also helps your blood vessels stay open, allowing blood to travel freely to the kidneys. Staying hydrated can prevent kidney stones, which could otherwise contribute to kidney damage and aggravate proteinuria. 4. Reduce your protein intake, but don't eliminate it. While protein is essential for your body, consuming too much of it can worsen proteinuria, particularly if your kidneys are already compromised. When your kidneys are struggling to filter waste, excessive protein in the diet can add more strain, leading to even more protein leakage into the urine. However, completely eliminating protein from your diet isn't a solution, as it could lead to malnutrition. Instead, you should focus on eating the right amount of protein for your body and kidney health. For most people with kidney issues, a moderate protein intake is recommended, and plant-based proteins, in particular, can be easier on the kidneys compared to animal-based sources. Consider incorporating more plant-based protein sources like beans, lentils, quinoa, and tofu into your meals. These foods provide all the necessary amino acids your body needs without the extra strain that animal proteins can cause. Additionally, limit your intake of red meat. processed meats, and full-fat dairy products, which are harder for the kidneys to process. Work with a healthcare provider or dietitian to find the right balance of protein in your diet based on your kidney function. 5. Adopt a DASH diet. The DASH dietary approaches to stop hypertension diet is one of the most highly recommended eating plans for reducing high blood pressure, and it's equally effective for managing proteinuria. This diet focuses on fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while limiting sodium, fats, and sugars. Research has shown that following a DASH diet not only helps lower blood pressure, but can also reduce the amount of protein that leaks into the urine. This is particularly beneficial for people with high blood pressure or early signs of kidney disease. By increasing your intake of nutrient-dense foods, you can improve your overall kidney health. Here are some simple tips to follow the DASH diet. Eat 4 to 5 servings of vegetables each day. Incorporate more whole grains like brown rice, quinoa, and whole wheat bread into your diet. Choose lean sources of protein, such as fish, skinless poultry, and legumes. Limit your intake of sugary beverages, sweets, and red meat. Stay mindful of your sodium intake by avoiding processed and packaged foods. 6. Lose excess weight. Excess weight doesn't just affect your blood pressure and blood sugar, it also puts a strain on your kidneys. Fat deposits around the kidneys can contribute to kidney damage and proteinuria, while weight loss has been shown to improve kidney function. Losing even a small amount of weight, just 5 to 10% of your total body weight, can have a significant impact on reducing proteinuria and improving kidney health. The key is to focus on gradual, sustainable weight loss by adopting healthier eating habits and increasing physical activity. Start by setting small, achievable goals. Aim for 30 minutes of moderate intensity exercise, such as walking, swimming, or cycling, most days of the week. Reduce your calorie intake by cutting back on processed foods, sugary snacks, and fast food, and opt for nutrient-dense meals instead. Not only will weight loss benefit your kidneys, but it will also lower your risk for other health issues like heart disease and diabetes. 7. Quit smoking. Smoking is harmful to nearly every organ in your body, including your kidneys. It damages the blood vessels that supply your kidneys, reduces their ability to filter blood, and increases the risk of proteinuria. Quitting smoking is one of the most important steps you can take to improve kidney function and prevent further damage. Studies have shown that people who quit smoking see a noticeable improvement in kidney health over time. If you're struggling to quit, talk to your healthcare provider about available resources, such as nicotine replacement therapy, counseling, or medication that can help make the process easier. Quitting smoking not only benefits your kidneys, but also reduces your risk of other serious conditions like heart disease, stroke, and cancer. 8. Use medications to protect your kidneys. Certain medications can help reduce proteinuria and protect your kidneys. These include ACE inhibitors like lisinopril and ARBs like losartan, which work by lowering blood pressure and reducing the strain on your kidneys. In fact, these medications are often prescribed specifically to reduce proteinuria in patients with kidney disease. Research has shown that ACE inhibitors and ARBs can lower proteinuria by up to 35%, helping to slow the progression of kidney damage. If your doctor has prescribed these medications, it's important to take them as directed to maximize their protective effects. Additionally, statins, which are commonly used to lower cholesterol, can also help protect your kidneys by improving blood vessel health. 9. Avoid over-the-counter NSAIDs. Non-steroidal anti-inflammatory drugs NSAIDs, such as ibuprofen and naproxen, are commonly used to relieve pain and inflammation. However, they can be harmful to your kidneys, especially if used frequently or in high doses. NSAIDs reduce blood flow to the kidneys, which can worsen kidney function and increase the risk of proteinuria. If you have kidney issues, it's best to avoid NSAIDs or use them only under the guidance of your healthcare provider. Instead, consider alternative pain relievers, such as acetaminophen, which is less harmful to the kidneys. 10. Monitor your kidney function regularly. Regular monitoring of your kidney function is essential if you want to prevent or manage proteinuria. Blood tests, urine tests, and blood pressure checks can help detect any changes in your kidney health early on. If you already have proteinuria, it's important to track your progress to see if the steps you're taking are making a difference. Your doctor will likely check your kidney function by measuring your glomerular filtration rate (GFR) and testing your urine for protein levels. By staying on top of these tests, you can catch any potential issues early and take action to prevent further kidney damage. In conclusion, managing proteinuria and protecting your kidneys is achievable with the right lifestyle changes and medical care. By controlling your blood pressure, managing your blood sugar, staying hydrated, and following a kidney-friendly diet, you can reduce proteinuria and improve your kidney health. Remember to work closely with your healthcare provider and stay proactive about monitoring your kidney function. Take control of your kidney health today and give your body the best chance to heal.